Melasma, what are the best treatments? Melasma is a pigmentation disorder of the skin mostly affecting women, especially those with darker skin. It is commonly seen on the face, and appears as dark spots and patches with irregular borders. Melasma is not physically harmful, but studies have shown melasma is a common known that it can lead to disorder, with a prevalence of 1% that can lead to psychological problems and poorer quality of life due to the changes it causes in a person, an increase to 50% in higher person's appearance. Risk groups, including those with darker skin. Melasma is known as the mask of pregnancy since hormonal changes caused by pregnancy. Can melasma be prevented? As well as hormonal medications such as birth control pills, are major triggers for excessive skin pigment production in melasma. Currently, melasma cannot be fully prevented in people who are likely to develop. Sun exposure is another develop this condition due to their genetics, skin important controller type, hormones, or sun exposure level contributor to melasma. Avoiding direct sun exposure during peak hours, 10 a.m. to 4 p.m., diligently using high SPF sunscreens, and avoiding hormonal medication. What sunscreen should when melasma patients use? Possible may help. Choosing an appropriate sunscreen is critical against if you develop melasma flares and reduce and studies have shown that for some people, it spectrum might be more convenient to use cosmetic product tinted sunscreen occurrence such as foundations that contain both UVA/UVB beams, ester treatment, blockers, and visible light blockers such as iron oxide. These products can conceal dark spots and therefore alleviate the strict, especially psychosocial impact of melasma, and at the same time act as a containing sun protection is the mainstay of an iron oxide sunscreen to protect against darkening of the any melasma treatment regimen can lower pigment production. It is important for people with melasma in this asthma to know that skin in melasma visible light can go through windows, and therefore even if they are not out in the sun, they can patients and still get melasma flares by exposing themselves to they block visible lesions. Light while driving or sitting by a window. Light as well as UVA/UVB rays. Non-tinted sunscreens, on the other hand, do not block visible light. Can melasma be treated? Currently there is no cure for melasma. However, there are several medications and procedures available to manage this condition. It is important to know that these treatment options may result in an incomplete response, meaning that some of the discolorations become lighter or disappear while some remain unchanged. In addition, frequent relapses are common. It is also important to be aware of possible side effects of treatment, including darkening of the skin caused by inflammation induced by the treatment, or extra lightening of the skin in a treated area. Using the appropriate medications under the supervision of a dermatologist can help achieve treatment goals and maintain them with fewer relapses. Common melasma treatments. The most commonly used treatments for melasma are skin lightening medications that are applied topically. These include medications such as hydroquinone, azelaic acid, kojic acid, niacinamide. Pregnant women who constitute a big proportion of melasma patients should avoid most of these medications except for azelaic acid, which is a and safe choice during pregnancy. Hydroquinone is a commonly used skin lightener that should only be used for a limited time due to anexamic side effects that may happen with prolonged use. It can be used for up to 6 months for initial treatment and then occasionally if needed. Acid. These medications work by reducing pigment production and inflammation, and by reducing excess blood vessels in the skin that contribute to melasma. In most patients, a combination therapy is needed for treatment for melasma. A common choice is the combination of hydroquinone with a retinoid that increases skin cell turnover and a steroid that decreases skin inflammation. Oral medications, including tranexamic acid, are usually considered in more severe melasma cases. This medication is thought to help melasma by reducing pigment production and by reducing excess blood vessels in the skin. Maintenance therapy and prevention. After achieving improvement of melasma lesions, strict sun protection and maintenance therapy need to be continued. Skin lighteners other than hydroquinone can be used in combination with retinoids to maintain the results, and hydroquinone therapy may be used intermittently if needed. Takeaway message about melasma. The key point in management of melasma is to use sun protection all the time, and to avoid other triggers such as hormonal medications when possible. Since none of the available treatments are a cure, prevention is the best option. People with melasma should see a board-certified dermatologist for evaluation and appropriate treatment regimens to manage melasma and maintain the treatment results.